I would first like to yield to the gentleman from Pennsylvania who will introduce our first witness.
Thank you, Chairman. I want to thank Chairman Tiberi for his leadership in convening today's hearings to improve health IT and innovation in today's healthcare field and to generate greater efficiency in America's seniors, for America's seniors and patients, as well as saving U.S. taxpayers an awful lot of money and doing it in the right way. A leader in this field is Teletracking, a company based in Western Pennsylvania. In fact, it's in Pittsburgh, Pennsylvania. Teletracking's President Michael Gallup is testifying before us today to share Teletracking's success in transforming companies from a patient flow automation company to a real-time automated operations management provider. Teletracking's winning strategy has helped healthcare providers achieve broad operational efficiencies and cost savings. Mr. Gallup is leading Teletracking's transformative healthcare policies. I look forward to his testimony today. And on a personal note, Mr. Chairman, I'd like to just briefly talk about a man named Victor Phillips, who died March 21st, 1991. Mr. Phillips had open heart surgery. He was in the hospital, and after the event, he had to be taken downstairs to another room for another event to take place, or some type of a healthcare thing. I think it was dialysis. After they completed that, Mr. Phillips was on a gurney for almost 3 hours because they forgot where he was. So he laid on this gurney for 3 or 4 hours. Finally, somebody came by and said, "What is this patient doing here?" They said, "We don't know. He had a procedure done." He said, "He needs to go upstairs. He just had open heart surgery, and he's been disconnected from all his monitoring machines." They got Mr. Phillips up to his room, but by that time, he had slipped into a coma. He lived for about a week. Now, this is a guy who was a World War II veteran. He survived a battlefield, but he did not survive his time in the hospital. And I can tell you that Mr. Phillips at that time was 77 years old. I knew him for about 10 years. And the way I met Mr. Phillips is he was the father of my wife. And I watched as he lay dying and thought, if somebody had known where he was, this never would have happened. Teletracking is a type of company that says this isn't going to happen anymore. We're doing it more effectively, more efficiently. And I tell you what, there's not a day that goes by that I don't thank the private sector for coming in here and telling us how to solve problems. The solutions are there with you. You've done great work. Chairman Tiberi, I mean this sincerely. Thank you so much for bringing this hearing up. And I really wish I could go back in time to see my father-in-law again, and I'm sure I will see him again. But it was really to sit and watch that man after going through open heart surgery and then get lost, not because he wasn't able to survive the surgery. He was lost somewhere in the whole system. So, Mr. Gallup, thanks for being here, and thanks for all of you being here. You do great work, and we look forward to your testimony. Thank you, Chairman.
Thank you, Mr. Kelly. And last but not least, the pride of Butler, Pennsylvania, Mr. Kelly is recognized for 5 minutes.
Thank you, Mr. Chairman. I want to thank all of you for being here today. I think it's interesting. When I first ran for office, I was really trying to champion what we do in the private sector, and I had people constantly tell me, "You know, your problem, Kelly, is you don't get it. Look, the government can't be run the way the private sector is run." And I've said, no, it's just the opposite. That's the antithesis. The private sector can't possibly run the way a government does. There's a handout. I think, Mr. Gallup, you provided it. I think here's where the rubber meets the road. It's not about the money that we spend. It's about the money we spend that's used inefficiently and effectively. So if you could, just kind of walk us through this, because I don't understand how people can indulge in deficit spending, not year after year, but decade after decade, and build a long-term debt that we know is going to sink our country, and say, you know, the problem is we're just not extracting enough money from hardworking American taxpayers. These people are going to have to cough up more money to support our inefficiencies. So if you could, and I think this is really stunning, and this really gets to the thing, listen, is it about policy? Yes. But more importantly, it's about people. It is about people. Mr. Short, your grandfather, my father-in-law, this didn't have to happen. And it wasn't because they weren't spending money. It's because they were ineffective and inefficient, something we can't tolerate in the private sector. Well, you can, but you can't do it long because you go broke. Mr. Gallup, if you would, when I look at this, and especially if we look at, this is incredible, the United States of America. Now, Pat, listen to this. Out of 51 countries, the United States of America ranks 44th out of 51 And we've really worked hard. We've been able to beat Bulgaria, who's number 45, and we're just about catching up with the Dominican Republic at 43. And it is hard for me to sit here and look at who we are and what we've been and how we've led the world and everything. Gosh, we can put a guy on the moon, but we can't get him through the emergency room. We can invent the internet, but we can't get people through the hospital system. What the heck is wrong with us? But look at the spending. It isn't for lack of investment. Mr. Gallup, kind of walk us through this, because this is stunning and it's also damning. It will ruin this country. If you can, this is incredible.
I think you just did a great job of it. So, I mean, I think the best thing I do is quote our clients, right? They know what's going on. And I think even the last Medicare question is very interesting, where what should we do about innovation? We shouldn't penalize people for coming up with innovations, right? Number one. So if someone figures out how to do something better, the first thing they're going to do is cut, right? And that kind of scares people. But as we quote our clients, they will tell you the money is in the system, right? They'll say that. It's exactly what you're saying. There's enough money in the system to get the patients through and give them the care that they need if we cut out the inefficiencies. To your point, we know that the CBO says 41% of the future of our hospitals are going to be running in the red. Why? Is it the funding issue, or is it the fact that we don't have the right models in place, that we don't have the right efficiencies put in place, and we haven't decreased the cost of an adjusted discharge, right? We have enough, and I think Chairman Tiberi saw this, right? There is enough bricks and mortars. There is enough out there to be able to go and do this. This isn't about cutting resources. You know, we have a doctor shortage. We have a nurse shortage. We have all these shortages out there. How do we fix that? Well, let's get them more productive. Every study you see out there, a nurse is 30% productive. The other 30%, we've got them stuck documenting. The other 30%, they are out there trying to, and I know that isn't at 100, so it's 33, but the point being is, they are out there finding stuff, wasting their time. So if we can take labor and help them become more productive, if we can help doctors become more productive and not doing things they don't want to do, we then get more patients through at the same price. And that's what we've proved in the NHS. That's what we've proved at many clients that will stand up and say this is working for them. We're seeing thousands of more patients, not just in the clinics, I mean, not just in the hospital, but in the clinics also. And that is what's going to cut the cost, right? If we can get more through at the same price, we have solved a lot of our problems.
Anybody else? Because you all have the answers. You have the answers. It's just, are we listening, and can we come up with a legislative fix to it? And I'm saying we have to do it, or we bankrupt our nation.
Mr. Kelly, I'm not sure if I'm allowed to say hallelujah, but I'm thinking it with your comments. But I think if you piece together all the great work that many organizations like these folks represent, I think the roadmap is out there. We all see the waste. We're all trying to improve it. My impression, even if you look at what the Pioneer has done, it's trying to look at where everybody is delivering care and try to do something that will work equally for everybody. And that's where you probably leave out those that are doing the best work and not trying to figure out how they could help create the roadmap that really needs to be the long-term blue sky. So I think the information is out there. If we can piece it together with folks like at this table, I don't think it would be that hard to do. But I appreciate your comments.
Well, I can't tell you how much I appreciate you being here, and I'm sure we're going to run out of time. But let me just say this to you. It's only over when we decide it's over. It's our ability to stick to the message and stick on course and make sure that we fight this to the very end. This is a win for every single American. It does not matter to me how they're registered, by the way. Yep. We can win this battle. The big thing is we just have to refuse to lose. We can win, and we can win for every single American. Thank you all for being here. Chairman, thank you so much.
Mr. Kelly, would you like to submit those statistics for the record?
Yes, I would love to submit them for the record. Thank you.
Without objection.
Thank you.
Thank you, Mr. Kelly.